Have you ever wondered about the anatomical names we use, or the people behind the pathologies? Think Liz Frank, Chopart, Dupuytren, Galen, Vesalius, Achilles, Morton, Graves, Lister. These are all examples of eponyms, a person after whom a structure or entity is named, and they're everywhere in ultrasound, they're everywhere in radiology, they're everywhere in all of the anatomical sciences. But for every eponym that exists, there is someone, generally of academic persuasion, vehemently opposed to their use, and whom vociferously call for their complete eradication. They argue that they are controversial, confusing and contentious, patriarchal and misogynistic, and an obstacle towards global understanding and best practice. But I'm not so sure. I think there are a number of overlooked and misunderstood benefits of eponyms, and the idea of this presentation is to share some stories of just some of the eponyms we use, their origins, their controversies, and their upsides, so that we may have a more rounded answer to the question, should we be using the surgeon's name or the anatomical name? Any such discussion must start with Galen. Galen of Pergamon was a 2nd century Greek philosopher and physician. He was a personal doctor to Marcus Aurelius and the gladiators, and we can therefore deduce this man.
My name is Maximus Decimus Meridius, commander of the armies of the North, general of the Felix Legions, loyal servant to the true emperor Marcus Aurelius, father to a murdered son, husband to a murdered wife, and I will have my vengeance in this life or the next.
Galen was a prolific writer of anatomy and medicine, and is responsible for much of what we know and name today. So prolific that more work of Galen survives than that of any other ancient Greek text, and this is in spite of the fact that Galen practiced primarily on pigs, cattle, and monkeys. But anatomy was said to be consistent and constant across the species, and such was the esteem in which Galen was held that his work went unchallenged for over 1300 years, and his influence is evident in the works of Leonardo da Vinci. This is da Vinci's 1507 drawing of a woman's torso. Look closely and you'll notice the aortic arch is bovine. The left carotid artery has a common origin with the innominate artery, as described by Galen. And rather curiously, the uterus is spherical in shape, an ode not only to Galen but to the dogma of the time. You see, the uterus was considered the spiritual centre of the female, and as such had to be depicted as a perfect sphere. If you're like me, you're probably wondering how a man renowned for his brilliance and genius got something so wrong. Well, the answer to that is human dissection wasn't performed until the latter part of Da Vinci's life. The common misconception is that this was by decree of the Catholic Church. But the Church never banned dissection. On the contrary, the Church encouraged the exploration and dissection of God's greatest creation. It was the fear of dissection that was the preoccupation of the day. The belief was that an incomplete burial would jeopardize your chance at posthumous grace. So omnipotent was this belief, so omnifarious, that the greatest wordsmith in the English language, William Shakespeare, had inscribed on his tomb the words, "Good friend, for Jesus' sake forbear to dig the dust enclosed here. Blessed be the man that spares these stones, and cursed be he that moves my bones." Human dissection was reserved for criminals and vagrants, seen as a punishment beyond death. Rembrandt depicts this in his The Anatomy lesson of Dr. Tulp. The centrepiece of this painting, and the body that's being dissected, is that of Ernst Kind, a man who was convicted, executed and dissected on the very same day he was caught stealing another man's cloak. Rumoured to be at this very anatomy lesson was René Descartes, arguably the greatest philosopher and mathematician the world has known, and this man, Philip Verheyen, who features in another albeit duplicitous image from Premnath. Verheyen was an anatomist, a surgeon and an amputee. One evening, while descending the stairs of his loft, he cut his leg on a rusty nail. Within a week, he was consumed by fever, and it was clear that the leg would have to be removed. But like many of the time, Verheyen took it literally that our physical bodies would rise with the coming of Christ. And so he begged and pleaded to have the leg preserved. So once the leg was amputated, the infiltrations of gangrene removed, the leg was preserved in a makeshift vessel filled with brandy and black pepper. This sat atop the windowsill of his workshop, but not long after this operation, Verheyen began experiencing debilitating and excruciating pain in the leg that both was and wasn't there. He allegedly wrote, "What is it that awakens me, since my leg has been separated from me and is now floating in alcohol? There is no reason for its suffering, no such pain that can be logically justified, and yet it exists. I look at it and simultaneously feel it. I touch my bodily existing limb in the guise of a lump of preserved flesh, and I don't feel it. The thing that hurts does not exist, a phantom pain. In an attempt to find the source of said pain, the story goes that Vahine dissected his own amputated leg into hundreds and thousands of smaller components of muscles, tendons, nerves, and in doing so, became fascinated with the main tendon of the calf, the tendon that connects the calf to the heel, the tendon at the heart of the mythological story of Achilles, and so coined the term Achilles cord or Achilles tendon. And when you think about it, is there a body part better named? This part by which the goddess Thetis grabbed onto little Achilles and dipped him in the river Styx to immunize him from death for all of eternity. This part by which Paris shoots a poisoned arrow through the one unprotected part of Achilles' body, killing him instantly. No, there is no body part better named, and this therefore has to occupy the central argument in the case for eponyms. Those who argue against the use of eponyms offer the rather vacuous and frankly boring alternative, the calcaneal tendon. Rembrandt pays homage to another doyen of anatomy in this same picture. Notice the book at the bottom right of the canvas. This is the book The Fabric of the Human Body by Andreas Vesalius. Vesalius was the first to challenge Galen's anatomy. He made over 200 corrections to the work of Galen and famously said that Galen was deceived by his monkeys. You'd think that a man that produced such revolutionary and epical work, a man who is said to have fathered modern anatomy, would be remembered with commensurate reverence, perhaps through an equally noteworthy eponym, but alas, no. Vesalius' name lives on through the small and rare accessory ossicle at the base of the fifth metatarsal, the os Vesalianum pedis. We're probably all aware that patients who present with pain at the base of the fifth, well, it's never peroneus brevis. It's usually an insertion of the lateral band of the plantar fascia, but on rare occasions it can be due to this, the os Vesalianum pedis. A contemporary of Vesalius was the now infamous Gabriele Fallopio, and Fallopio has a huge number of eponyms. To be fair, it's unclear whether these were self-proclaimed or bestowed by others, but nonetheless there is the fallopian muscle, or the pyramidalis, the fallopian ligament, or inguinal ligament, unless you're French, in which it's the Chopart ligament, and you'd be mistaken for thinking that the fallopian canal is a structure located somewhere in the pelvis. But the fallopian canal is an osseous canal of the petrous temporal bone, through which the facial nerve traverses, a clearly counterintuitive and confusing element of eponyms. But without doubt, his most famous eponym is of course the fallopian tube, an example of the patriarchal nature of not only eponyms, but the patriarchal nature of the language in medicine. Leah Kaminski is an Australian author and GP who wrote a tremendous article for the BBC at the height of the Me Too movement. She wrote, "Take a tour of the female pelvis and you'll encounter a few incongruous people along the way. How did James Douglas end up tucked behind the uterus? What is Gabriele Fallopio doing hanging around the ovaries? And why is Gaspar Bartholin the younger attached to the labia? Each of these dudes have ended up immortalized in the female pelvis. Their names live on eponymously, immortalized like audacious explorers for conquering the geography of the female pelvis, as if it were terra nullius." She argues for a system that's not centered on the historical victories of men discovering body parts, but instead uses descriptors that are useful and educational to the body's owner. This would help to alleviate the obstacle towards global understanding and would better align with best practice principles. But I'm not convinced the alternative to a dead white man's name is best. Take pouch of Douglas or rectovaginal pouch. Take Baxter's neuropathy or a neuropathy of the first branch of the lateral plantar nerve. Take Joplin's neuropathy or a neuropathy of the first branch of the medial plantar nerve. But speaking of best, we must speak of the French, for the French have made so many significant contributions to so many disparate areas: history, literature, mathematics, and of course, anatomy. And Chopart and Liz Frank, both giants of their fields and of their time, offer a means to simplify the anatomy of the foot. The Chopart line separates the hind foot from the midfoot, named after Francois Chopart, the father of urology, who reached orthopedic immortality through a procedure he performed only once. He removed the forefoot of a man who had an infected, non-healing ulcer on the dorsum of his foot, and he's said to have done so with Astley Cooper in attendance, who we'll meet in a moment, and whilst cannons from the French Revolution were being fired in the Parisian streets outside the hospital in which he worked. From an ultrasound point of view, assessment of the Chopart joint is crucial. At a minimum, we're assessing the calc-cuboid ligament, where avulsion fractures of the anterior tubercle of the calcaneus are not infrequent, and the talonavicular ligament, which, if injured, represents a more significant injury than your ATFL tear. It's treated more aggressively and has a longer return to play time. The Lisfranc line separates the midfoot from the forefoot, named after Jacques Lisfranc, a pioneering surgeon during the Napoleonic Wars. Lisfranc rose to prominence in treating soldiers who had fallen from their horse, had their foot stuck in the stirrup, and would suffer what we now know to be as a Lisfranc fracture dislocation. Gangrene and frostbite would set in, and Lisfranc pioneered an operation where he could amputate the forefoot in less than a minute, pretty important for the anaesthetised patient. And Lisfranc has become a bit of a buzzword in NRL circles in recent times because a Lisfranc injury is such a significant injury. The average return to play time for a Lisfranc injury ranges between 12 and 20 weeks, and multiple studies have shown that the athletic performance in the 12 months post a Lisfranc ligament injury is markedly reduced. When they talk of a Lisfranc ligament injury, they're talking about an injury to this ligamentous complex that consists of the dorsal, interosseous and plantar components. On ultrasound, we see clearly the dorsal Lisfranc ligament, and this is something that I now incorporate into every trauma foot and ankle series I perform, because to detect a Lisfranc ligament injury, well, that's monumental, and essentially renders that ATFL tear redundant. The interesting thing about Lisfranc is that he trained under Dupuytren, the same Dupuytren as in the palmar contractures of the hand, and the two hated each other. In fact, most people hated Lisfranc, and everyone hated Dupuytren. Lisfranc described him as the brigand of the Hotel Dieu, the hospital in which they worked, and others described Dupuytren as the best of surgeons and the worst of men. As it turns out, Dupuytren wasn't even the first to publish on palmar contractures of the hand. Ashley Cooper, who was in watching Chopart operate, published on them 10 years prior. So in that respect, Dupuytren's disease should actually be called Cooper's disease, just like Graves' disease should be called Parry's disease, and Lister's tubercle, well, no one really knows why Lister's tubercle is called Lister's tubercle. Joseph Lister has more to do with the mouthwash Listerine than he does the dorsal tubercle of the distal radius. Similar can be said about Morton's neuromas. Thomas Morton never described perineural fibrosis and scarring of the interdigital nerves. He published on pathology of the fourth MTP joint. Yet his name is now synonymous with every neuroma of the forefoot, and Heuter, Hauser and Iselin, who did publish on neuromas of the first, second and fourth web space respectively, have been largely forgot by history. But this sort of conjecture and contention is not confined to anatomy. Leibniz has a greater claim to the discovery of calculus than Newton, but that's not what history tells us. But calculus, conjecture and contention aside, I think there is an underrated benefits of eponyms, that being the heuristic value that they offer. In my opinion, ultrasound education is littered with analogies that are as tenuous as they are tedious. For example, I can't see the bird's beak that's supposed to represent the insertion of subscapularis. I've never been a car man, so the Mercedes-Benz sign when looking at the conjoint tendon of the hamstring helps me none. And the Eye of Sauron sign with respect to rectus femoris, well, I'm unsure if that's supposed to represent a degloving injury, paraseptal injury, or an injury of the indirect tendon of rectus femoris. And in any case, I'm more a Haruki Murakami and Amor Towers fan than I am J.R.R. Tolkien. But give me an eponym and my ability at recall is unimpeded. To that end, I wish there were eponyms to replace some of the cutaneous nerves that we scan. The lateral antebrachial cutaneous nerve of the arm, even though we detect it from the medial aspect of the bicep, always eludes me when I need to remember that name. And if we had an eponym to replace the os intermetatarsium, an accessory ossicle at the base of the first and second metatarsal, then, if nothing else, that would save us having to spell INTERMETATARSEUM, looking back at it and thinking, I'm not sure if that looks right. Finally, there is a school of thought that says eponyms should be banned or removed due to the unscrupulous nature of the men they're named after. I speak here of Rita syndrome and the bundle of his. Rita syndrome is an inflammatory arthropathy post-fever, something we have knowingly or not encountered, which is named after Hans Rita, a German Nazi doctor who, it goes without saying, committed atrocious war crimes during World War II. For any cardiac guys out there, the bundle of his was named after William His, a man who preached eugenics, a belief system that aimed to cleanse the population of undesirable characteristics through selective sterilization, a system that would become synonymous with the Nazis. Those that argue along these lines, that is to say those that believe eponyms should be banned or removed due to the amoral, wicked and nefarious ways of men gone by, are clearly unaware that Pythagoras, whose theorem is taught to every child in every classroom right round the world, once drowned the man man who proved the square root of 2 is irrational for proving that the square root of 2 is irrational. So should a discussion on eponyms take place? Absolutely. Should they be disbanded and the entire lexis of the anatomical sciences be rewritten? No. Take away all the perceived positives, take away all the well-published negatives, and you're left with eponyms that, if nothing else, tell a story. And who doesn't love a good story? Thanks for watching, guys.